Hello friends, my name is Renu Mandral and I'm here to give presentation on my Week 6 assignment. The topic of my presentation is improving medical adherence in adults with serious mental illnesses. In my presentation, I'm going to talk about a multimodal digital intervention in comparison to standard intervention. So my presentation would have different parts which includes background and significance, proposed intervention and supporting evidence, the theoretical framework, implementation plan, outcome measures, the timeline, and lastly, I'm going to attach a link for your reference to the problem, to the presentation. So in the background and significance, we need to know what is the problem. Secondly, we also need to know what is the impact of that problem. And then finally, what is the need for the intervention for that problem. So here, the problem is medication non-adherence among adults with serious mental illnesses or SMI, and it remains a significant challenge in outpatient psychiatric care. So how this problem gonna impact? So we all know the poor adherence lead to symptom exacerbation. It also causes a relapse, increased psychiatric hospitalization, reduced quality of life, and finally, the increased healthcare cost. So as we know the problem and the impact, so with the problem and impact, we understood that we need some intervention to tackle this problem. As the empirical evidences confirms, the suboptimal medication adherence is prevalent in psychiatric patients. It necessitates the implementation of evidence-based intervention to promote treatment engagement. Let's talk about what are the proposed intervention and how we're going to support these intervention. For that, we need to understand what is our P code question. In P code, P stands for the patient or the population, the I stands for the implementation, C stands for comparison, O is the outcome, and T is the timeline. So what is P here? In adult patients ages between 18 to 65 diagnosed with a serious mental illness in an outpatient psychiatric clinic. So implementation is how does the implementation of a structured multimodal reminder system, which is like mobile app notification and weekly telephone follow-up, we are comparing it, which is C, to the standard treatment, which is routine office visit and written education. And we're going to see the outcome, so how it's going to affect medical adherence rate, which we can easily measure by medication adherence rating scales, or it is also called as MARS score. We're going to measure this outcome within a time period of 12 weeks, which is the T of P code question. Let's talk about the level 1 evidence, which is through the meta-analysis. The meta-analysis confirms that the digital health intervention, specifically the automated reminders and remote monitoring, they causes significant improvement in medical adherence and the treatment engagement by the psychiatric patient. Level 2 evidence, which include RCD, which has RCD established that integrating smartphone-based reminders with clinical verification significantly enhance medical adherence. It also results in clinical stability, treatment engagement when we compare it to the standard care, which is like office visit and written education. Let's talk about what is the theoretical framework for this problem and the solution of this problem. The theoretical framework includes, first of all, the Pender's health promotion model. It also includes foundational for implementing digital adherence interventions. We have to also understand the mitigating obstacles. The obstacles are reducing barriers like human behavior, like forgetfulness, or maybe the physical barriers like complex routines, clinical isolation. In theoretical framework, we're going to also talk about the highlighting gains like MARS tracking, which demonstrates the benefits like clinical stability, increased clinical stability, and lower relapse risk. The building agency includes cultivate self-efficacy, encouraging proactiveness in patient, and autonomous health management. Let's talk about the implementation plan. So here there is interprofessional team. Interprofessional team includes psychiatric mental health nurse practitioner, which are the leaders, psychiatrists, nursing staff, social worker, IT specialists, administrator, and QI representatives. The second thing we have to do in implementation plan is we have to screen the patient, the identification of the population which are non-adherent. Then we have to do the interprofessional team build-up workup. We have to utilize the routine intake and follow-up visits. We have to, so that we can screen for medical non-adherence. We have to promote engagement, treatment engagement, assess and document baseline of medical adherence rating scale scores for an eligible patient. Then we have to integrate the workflow by embedded automated reminder prompts, adherence documentation templates into EHR. We have to standardize the digital referral process during the clinical encounters. We have to provide the patient the onboarding materials like how to navigate an app, how to troubleshoot the problems comes. Then the intervention delivery, we have to initiate a 12-week automated mobile reminder sequence, and we have to execute the structured weekly telephone follow-ups to provide support and reinforce adherence. Apply motivational interviewing techniques to enhance patient self-efficacy and treatment completion. Then we have to monitor and evaluate. We have to track module completion, notification frequency, patient's response rate, reassess the MARS score at 2 points. One is the midpoint, which is 6 weeks, and then post-intervention, which is week 12. Then we have to hold the bi-weekly team huddles to review the progress, optimize the intervention workflows, and then finally we have to work on the sustainability, like to keep this plan for a longer time, like identifying long-term staffing, technical training requirements. And the other thing is formalize adherence to the monitoring within the routine behavioral health clinical pathways. We have to explore the sustainable funding via quality improvement projects. Then what is the outcome? The primary outcome is the medical adherence. We can see there is an increased medication adherence rate, which is MARS, by at least 20% from the baseline when we start the project by clinical improvement. The secondary outcome is clinical stability. We will see the reduction in the frequency of psychiatric hospitalization and relapse episode. We will also see the treatment engagement. We can see the there is an improvement in outpatient appointment attendance, and the patients are actively participating in care. Then we can also take a feedback by patient experience. We enhance patient satisfaction in the feedback and digital adherence support tools. Then we have to utilize the platform by monitoring app login frequency, notification response rate, and by studying the module engagement. So let's talk about a little bit about the timeline. In the timeline, you're going to talk about all these things like project planning, activities, recruit interprofessional team. So in the timeline, you have to evaluate all these things at certain period of time. So finally, I'm going to attach the references in a link so that you can go through my presentation and can understand the topic more clearly and can give your feedback how to improve my presentation. Thank you so much for your patient listening.